Welcome to the morning show. Canada's Conversation starts now.
So this is, we're doing a segment at 8:40 about tattoo removal, which I have said over and over again that two places I think I should invest my money, or anybody should, is pot and tattoo removal. These are both
growing industries,
going to be booming industries.
You're right.
So we're gonna actually talk about where it's progressed to and do a little demonstration later. But so the most first of all, who present has a tattoo?
Don't have one.
I do.
Yeah.
Don't.
But you don't regret yours.
No.
No.
Because it's I've had it since I was 18, so it doesn't even register on my. Although my 5-year-old showers with me, and she'll sometimes try to wash it off.
What's up now, your mom?
What's that? There, it's extra permanent marker.
That's going nowhere.
I kept a journal, you know, maybe starting when I was like, I don't know, my early teens, you know, you're really sappy and stuff, and I feel like a tattoo is a little bit like that. It's like reading your old journal and going,
yeah, it's cringy. You're like, I'm glad I only got one, because I thought about, in my 20s, still thinking about, like, I'm a Pisces, I should get fish going around my belly button. No. And I was close.
You're close.
So,
it represents such a time in your life.
Yeah, they have a list of the most regrettable tattoos. Names is #1.
Yeah,
that's probably the most famous
Johnny Depp.
one.
Yeah.
Winona Forever. That was his girlfriend, Winona Ryder, way back in the 90s. They seemed inseparable. And then guess what? They broke up. And then he got it changed to Wino Forever.
Wino Forever, which was actually kind of smart. Hearts/roses on your chest. Oh, there we go. Yeah, it's the barbed wire.
Your arm,
It's like anything tribal or barbed wire around your arm.
Right.
Especially if you have like no tribal roots whatsoever, right?
Yeah.
It's sort of when people get the Chinese characters and they have no Chinese roots.
Yeah,
but do you even know what that's?
Yeah, can you read that? A dolphin anywhere.
A dolphin.
Is on this list. One of my girls, I think, because I went with, I actually went with 2 other girlfriends when I did this, and then my mom decided she was going to get a tattoo, a little tiny peace sign she got, and another one of my girlfriends went with her.
Okay.
Hi, Kitchener. And that girlfriend got a whale that kind of looks more like a dolphin.
Like a dolphin.
Yeah. So she falls into that. Flower on your ankle. Yeah, almost did that.
Yeah.
Hard or rough-looking neck tattoos or anything on your face.
Oh, no.
Yeah, that one is like.
Yeah, there we go. That's
although
guy from
sometimes
Blink-182,
I do respect when they make a full commitment. You know, that's a full commitment you're in, or I like the arms, what they call it, sleeve for the guys.
Yeah, tattoo.
I do like it.
Right. I just have a regret that I don't have a tattoo. I wish I got a tattoo one of the Olympics that I attended, like maybe the 1996 Olympics. I can, but I regret that I didn't do it at that moment. You know what I mean? At that time. But I was just way too focused on running. I was like, wait, tattoo might slow me down. And you know,
but that's the double-edged sword of a tattoo, is that it represents such a specific time in your life.
Sometimes, you know,
And if you're like emo when you're in your 20s and then you get over it, it's just to keep looking at that.
It doesn't work anymore.
Good morning. We have the new PicoSure Tattoo Removal Laser today. It works by a trillionth of a second to break down tattoos, help it go away within 3 to 5 treatments. If you look right here on lovely Jennifer, light skin, and a standard black, gray, green tattoo. We're going to start treating this today and start getting rid of these tattoos right away. So here I am with the PicoSure laser. We're going to start adjusting the parameters for the optimal tattoo treatment. We're going to increase the speed as we go, and we're going to change the fluence or the energy upwards and increase the spot size for the optimal treatment. For each treatment, we customize it to the patient's skin type, the type of tattoo, color tattoo, and the anatomic area. As we get this started, we're going to start going. So now that we have everything optimized, the parameters are set on our laser here, we've measured the tattoo, looked at the pigmentation, we're ready to start. Jennifer has already had her patient anesthesia, so she's frozen the area. Will feel minimal to no pain. What I'm going to do is start breaking it down in this area. What the PicoSure does is by the trillionth of a second, it helps to break down the fragments and start to treat it. If you look carefully here, look how that's frosting over. Right in front of our eyes, the PicoSure laser that we have here at SpaMedica is getting rid of Jen's tattoo. She's had it for 12 years, she hates it, her boyfriend hates it, her mother hates it, and here in a matter of seconds, we're getting rid of it. As I said, treatments vary from between 5 and 20 minutes. Cost will vary on the complexity and size of the tattoo, and a number of treatments will depend again on the size of the tattoo, but we're looking usually at between 3 and 5 treatments. So there's one pass. Take a close look, and you can see here we've gotten rid of the darkest areas, feathered around. There's a little bit of redness, which shows her immune system breaking it down. Jen, did that hurt at all for you?
Nope.
Wonderful. So just 10 minutes later, we're fully done. What we're going to get is a little small Band-Aid, polysporin, a light bandage, right on Jen's neck and shoulders. She can take this off tomorrow morning, shower, back to activities, gym, exercise. I'll see her back in 4 to 6 weeks, see how everything is healed, get her ready for her second treatment, and at that point we can plan for further treatments if needed. Let's look at some before and afters to see people after their course of treatments to really see the results in their totality.
Good morning, everybody. You are watching the morning show here on Global. I'm Liza Fromer. Thanks for being with us. Well, earlier in the show, we told you more and more people are regretting their tattoos. The good news, you're not stuck with them. Dr. Zell Krajden is here. He's the medical director at SpaMedica, and he joins us now to show us how you can get rid of the unwanted ink. Good morning.
How are you?
So good. I have a tattoo that I'm okay with for now, but
Yes.
I'm glad to hear that.
For now.
We're making progress. These stats, approximately $10 million is spent per year in Canada on tattoo removal, almost $100 million in the U.S.
At least, and that's actually 08-09 numbers. It's even higher now. It's grown about 40 to 50% even since those data were published.
Holy smokes. Okay, Sophia, welcome.
Hi.
Hi. So you have a tattoo.
I do.
And that is what? What is your little tattoo?
It's a little gecko.
It's a little gecko. It looks like it's kind of, how old is it?
6 years.
6 years.
Yeah.
So it's kind of all bled together a bit.
Yes.
And you've just decided you don't want it.
Yeah.
So how do we go about getting rid of
Sophia
that?
comes to the clinic. We take a brief 5-minute history, age of the tattoo, how it was done. Her story is a bit different. She's a brave soul who actually did this to herself. She did her own tattooing.
Yes,
so you
I
get
did.
the information about the type of ink, the color of ink. Once we do that, we do a basic skin test of her skin tone, and then we look at different wavelengths of laser we can use to help break down that tattoo and get rid of it.
So this is the machine?
Exactly. This is one of our machines. At SpaMedica, we have different wavelengths, different devices we can use. One is called the PicoSure. It's the newest technology. We've had it for about 15 months. This is the rev light that works well for some of the older colors, for oranges, for red. So essentially we use different wavelengths for different types of tattoos, different skin types, and how deep the ink is actually penetrated into the dermis or the skin layer.
Okay, so this guy is pretty small. So,
Exactly.
but very dark. So
Yes.
what would the process be here?
So she'd come into the clinic. We use 3 different kinds of freezing. One is a topical ointment that freezes the superficial epidermis. One is an air cooling device that actually numbs the skin. And the third, for painful or large areas, I actually take a needle and freeze the entire area. As a surgeon, I'm very happy to freeze the entire area. And once it's done, there's no pain at all.
You haven't had any of this done yet, is that
No,
correct?
not yet.
No, but that you must be relieved. That
Yes, there's some numbing or
Yeah, there are different
freezing.
gradations of options to make it, from slightly discomfort to no pain at all, depending on the patient's preference and, again, the location of the tattoo.
Okay, and how long does it take when you're sitting on the table, and then how long in total for it to be gone?
Small tattoo like this would take me about 15 to 20 minutes to treat. I do between 4 and 6 different treatments, about 6 to 8 weeks apart. So essentially within 6 months, she can get rid of the tattoo. With the older technologies, it was between 10 and 16 treatments.
Is that what we're seeing right
Exactly.
now?
So that's a video of me using the PicoSure. You can see that as I'm etching over the area, you can see it frosting. So the epidermal or superficial layer of the tattoo is actually gone. It's being ghosted away. And all you're left with is a deeper pigment that I'll get at the later treatments and or with different devices.
So will you still see anything left over?
After the first few treatments, definitely. Again, it takes between 4 and 6 treatments to get about 90% reduction.
Yeah.
So you will see it fade, incrementally as you go. If there's anything left over, what's called ghosting or whiteness. There's different tattoos that we can do to try and target that. But again, you're looking at about 80 to 90% reduction between 4 and 6 treatments with the PicoSure device.
And for the first time in history as well, 69% of people getting tattoos are women.
Yes.
Outpacing men for the first time.
Yes, exactly.
Ever.
So it's a totally different demographic than it was 40 years ago when it was, you know, sailors and different people like that.
Right. So the pigment of the skin, once you're completely done, will just pretty much blend back in.
You may end up with a little bit of a bruising effect where it's slightly darker.
Yeah.
The odd person gets some white ghosting, but it's a huge improvement compared to what you have.
Right. And how much on a scale of 1 to 10 does this bother you? It must bother you pretty significantly.
Yeah, I want to get it removed.
Right. What is it about it? Just feel like it's unsightly, or?
Well, it's not very good. I did it myself, so, you know.
Right. And does it make you self-conscious?
A little bit.
Yeah.
You know, it's just nice to get it removed now that we can do that.
Absolutely.
And the other thing that I'll do for people, I'll often do even 2 or 3 treatments, get 50% reduction, and they can over-tattoo. They'll go back to a good, high-quality tattoo parlor. They'll work with what they have left and use that as part of a new, nicer, higher quality tattoo.
Right.
So we can do that as well.
Does this work for any skin tone? Because I know with like laser hair removal,
For sure.
if you have darker skin, it's not going to work the same way.
For sure. I mean, as a physician, you always have to be cognizant of risk versus benefit, and skin tone is part of that equation. So essentially, when someone comes in with a darker skin tone, I'm more conservative, I'll do slower treatments, and counsel them on pigmentation afterwards, sun exposure, things like that. So you do have to be aware of that.
Right. And expense now, is it getting more or less expensive?
The pricing is pretty much the same, and it really goes by size. Small tattoo, about $400 per treatment. Large area, about $7 per treatment. And, you know, whole sleeve, that'd be more of a custom pricing issue.
A whole sleeve. I can't even imagine if all of a sudden. Are there any risks involved with this?
Small, you know, pain for the first few days, a little bit of blistering and redness. You can't have any sun exposure. Again, you're looking at about 90% reduction, so there often is some residual pigmentation or what's called ghosting or whiteness. But again, the amount of improvement that you're getting is tremendous.
Well, thank you so much for coming in, and best of luck with it. Appreciate it. Dr. Zell Krajden from SpaMedica. Nice talking to you. Good to see you.
Always.
Thanks. Gonna take a break. We'll be right back.